Happy New Year and welcome to Open Line. I'm Starlene Stringer. Now, last November, Dr. Keith Lepak called our attention to a health alert regarding a surge in pneumonia among older population. Our discussion led to this edition of Open Line, which will focus on health issues affecting seniors and what we can do to assist them and also promote their quality of life. We'll hear from Dr. Keith Lepak, Dr. Scott Schmidt, and Dr. Latricia Hicks with Parkland Health and Human System. We definitely want to thank them so much for being here. You guys, I appreciate you taking your time out of your schedule to come today.
Thanks, Darlene.
Thank you.
Thank you. Now, a lot of people are going, okay, so what's their backgrounds? Give us a little information about yourselves before we get started in the show. And we can start with you, Dr. Lepak. Tell us a little bit about your background.
My name is Keith Lepak. I'm a fellow of the American Academy of Emergency Physicians and the Health Authority for the City of Irving.
Wonderful. And Dr. Schmidt, same question.
I'm Scott Schmidt, and I practice family practice. I'm a chiropractor, a nurse practitioner, and I just finished my medical training for my medical degree.
Oh, you don't do much, do you?
No, not much.
All these overachievers. Yeah. And we have another one. Dr. Hicks, tell us about yourself.
Okay. So I am the geriatric education coordinator for the Department of Geriatrics at Parkland. And when I'm not doing that, I'm a professor for one of the community colleges.
That's wonderful, y'all. Okay, so a lot of people may not know, but the branch of medicine that focuses on older adults is called geriatrics. Y'all know that, and most people can easily tell you about the opposite side, which is pediatrics. But today you're going to talk to us about geriatrics because a lot of people don't have confidence when it comes to talking about that. They're not really quite sure what they're talking about when it comes to senior medicine. So Dr. Hicks, let's start with you. Can you clarify what exactly geriatrics is?
So geriatrics, I'm so used to saying what gerontology is. Geriatrics deals with older adults. It's the medicine that deals with older adults, the care of older adults.
I see. And so, Dr. Schmidt, how does that differ from the care that's given to middle-aged adults or young adults?
It's a good question. Often with older adults, some of the symptoms may be a little blunted or delayed. And when we are dealing with younger adults, usually things tend to be a little bit more obvious. So when we're concerned about illness with an older adult or a geriatric patient, sometimes we have to look more for the subtleties involved, particularly for family members or caregivers.
Interesting. And so, Dr. Lepak, what kind of disorders or impairments may be different when it comes to helping the elderly?
Well, we started off with pneumonia, and just as a segue from what Dr. Schmidt was saying, you know, sometimes the earliest sign in an elderly person might be exceptional levels of fatigue or confusion. You may not get the fever and cough ever, or certainly as a delayed symptom. So any alteration of mental status or exceptional levels of confusion, fatigue, incontinence, things like that, really. And you kind of need to make sure there's nothing physical going on with the elderly person or the young elderly person. You don't have to be totally disabled to have those off times.
Sure, and you often hear seniors talking about wanting to age in place or to be at home as they age and not actually be in a center or have someone caring for them. They want to stay where they've been all their lives. And so I understand, Dr. Hicks, that Parkland has a lot of programs in place to help them continue to live independently.
Yes, so the Department of Geriatrics have 4 different programs. We, of course, have our clinic where we treat individuals, but we also have the house calls program. We have the SOS program, which is our senior outreach services, and then we have our education program.
Okay, and tell us, so obviously the education program educates you on what you need to do, and is that for the elderly person, or is it for the caregivers or their family members? Who's it for?
It's for both. So we educate the patient maybe on the illness that they may have or susceptible to, and we also support the caregiver with education, like advanced care planning. Also with dementia care, we have an educational class that helps the caregiver with that. And then we do public speaking for individuals that are curious. You may have someone that is aging. You may have someone that is just interested in the topic itself. So we do public speaking seminars also, in-house and out in the community.
And people can find out about those different programs that are going on by going to your website, I'm sure.
Yes, parklandhospital.com/geriatrics, or they can call our main location for more information.
Wonderful.
Yeah.
And so I'm sure you get feedback on the programs that you've been offering. What have people said about them so far?
Well, like the dementia care, they want more. Because it's really hard for a caregiver to understand what's going on with their loved one. If it's a child to their parent, they want their parent to be back that person that they were used to caring for them, that strong person. So a lot of our caregivers want more information. So we do a basic general class on dementia care, how to deal with behaviors, what to do in reference to some of those behaviors, some of the indicators to look for. And when we give that class, the feedback for that particular class is, can we have another one? Some individuals like to come back again just to brush up on some of the things that's going on. So they're really excited. In regards to that particular class, with the advanced care planning, a lot of individuals don't understand what it is. So when we go through the class the very first time, some individuals are too embarrassed to say, I didn't know what that was. So when we go through it the first time, they want to come back to learn more about it, because the first time around they heard it, but they didn't really understand it. And so we are always asked, for additional classes.
I see. Well, thank
yeah.
you for explaining that for us. And Dr. Schmidt, I want to come to you now because, of course, there are a lot of common diseases out there. But do they present differently in the elderly community?
I mean, going back to what the first question, you do need to wear your detective cap when you're a clinician, because often the patient may come in presenting with one aspect or one symptom, and it does require you to look a little bit deeper and to make sure you're doing a thorough history with the patient. One of the things that we were talking about before we sat down together was just as care providers, doctors, clinicians, to really have a thorough care plan in place so that nothing is overlooked. Again, a lot of the elderly patients that are coming in are being brought in by somebody who's concerned about them. I've had patients that are in the room and they don't really know why they're there, but their loved one or their caregiver sees that there's a problem. So it does take some work to find out and spend some time with them.
Sure, that makes sense. And so, Dr. Lepak, do you find that sometimes, just possibly, something, let's say like pneumonia, it may be that a caregiver or a loved one may miss the symptoms of what they have because it may be different in that elderly person?
Very much so. Great point. And, you really have to do that thorough evaluation. I don't know how many times we do a routine urinalysis in the emergency room and find out that the reason for the confusion or not recognizing the favorite grandchild was actually just a urinary infection. And why wouldn't you fix that, immediately and think to fix that? That's a no-brainer just to get a good thorough evaluation. So urine, X-ray for pneumonia, things like that. Electrolytes are very often off in the elderly. Sometimes the sodium's horribly low, and that can cause confusion. So we really want to get in early and fix those medical problems before it results in a hospitalization or comorbidity, other comorbidities, which are kind of easy to figure out what's going to happen next.
Right. Well, I appreciate you saying you want to get them in early, and I can understand that for sure because both of my parents are aging. They're both now in their early 70s, but for me, I have to tell you, something happened years ago. I've had all kind of issues with my parents health-wise and just issues with the parents, period. But no, I tease. But seriously, with my mom, I remember her saying, I don't need to go to the doctor. I don't need to go to the hospital. I just have a cold. I just have a cold. And, we joke and tease now. It's like she'll give anything Robitussin. She's like, a little Robitussin and I'll be fine, or a little Tylenol or whatever. She's always trying to self-medicate. It is good stuff. But it wasn't for what she had because I ended up realizing she could not breathe. And she was like really bad. I had to call an ambulance, and it turns out it was congestive heart failure. And she thought it was a cold. I thought it was a cold. And then all of a sudden there was a sound like a freight train coming out of her body, and I knew something was wrong. So when should someone get help? Call 911 or go to a hospital or go to a doctor? When do you say, okay, it's enough of us saying it might just be a cold?
It's like a young mother with a child. They know their child's behavior. And so when they say there's something wrong, it's my job to keep looking till I find it, because they know there's something off with the kid. They really do. And the same thing with your parent. And you're there, And so your best judgment is actually probably better than some person who's never met them, and it's their job to do the basics and make sure they're not missing anything. So just that alteration in personality, Dr. Hicks, or behavior patterns, or you know, your best judgment really is good, and you should trust your Gestalt and get them that that evaluation. And if their regular doctor's too busy, which sometimes happens in the holidays, then one of the many freestanding emergency rooms or urgent care clinics, or certainly the hospital. If you think they're going to wind up staying overnight, just go to your favorite hospital.
Yeah, and I'm glad you said it's kind of that parent intuition, even though you're the child now, or whatever caregiver position you may have with that family member or loved one, but at the same time, you know that person better than most people out there in the world. And so another true testimony here with that same parent of mine, my mom's, you know, years later, I kept saying something's wrong. Something's wrong. Like, we go to restaurants and she's like, oh, you just order for me. I'm like, this is not my mother. You know, I was like, what is going on? Or I'll have what she's having. And then I knew, I'm like, okay, we're going to the emergency room right now. Something is completely wrong. And we do have to listen to that inner voice, that parental instinct in us to know that we've got to get something checked out. And for us, it was diagnosis of dementia and then Alzheimer's. And it's so important that you pay attention to those changes. And so he kind of pointed to you for that, Dr. Hicks. So I'm going to come to you and refer to you on that too. What should people do?
Well, I want to just kind of comment what he said on that. When people make excuses, they know. And when they have dementia, it doesn't happen overnight.
Right.
It's a slow process. So when they start making those excuses, like you said, she said, you know, you order it for me. Or like with dementia, with the memory loss, they start describing items versus saying that particular item. Like, give me that thing that you write with, instead of saying, can you give me a pencil? When they start making those excuses, then you, as, you know, if it's your parent, like with you, you have to be very vigilant in getting them to the doctor. But I've found that within the family, that there's always at least one person that can get that person to do whatever. It might take a while, but you should always consider who that person is. And whoever that person is, like with you and your mom, if you're the person, then
I have to call my brother.
okay, so it's your brother.
Right.
So with me, with my dad, it's me. I can get him to do whatever I need him to do, but he won't do it for my mom or my brother. So within the family, you have to look at the person that the loved one is willing to listen to more. Even though they fight with them, they can get them to do. So if you see those signs, you see them making those excuses, if you see them doing something out of the ordinary, for us, it may not be out of the ordinary, but you know the family member.
Right.
You see them doing those things, then they should come in for an assessment.
Okay. And would you like to add to that, Dr. Schmidt?
I mean, and I don't. I know we're talking about dementia and all, but there are so many other things. And from my perspective, a little puller from Dr. Lepak, he's at that critical stage with the ER visits. But my training being in family medicine and preventive medicine, I think we need to touch on that for a minute. That you know, scheduling regular appointments for a geriatric, any patient, but for a geriatric patient, having somebody in the family that can be the incentive for that person to go, getting the patient in my office for a routine physical exam when the emotions aren't high, when we're not in a state of delirium leading to dementia, when we're not in a panic leading to the ER visit, we can get a thorough history. I have patients come in with their, and we have all seen it, with their Ziploc baggies full of medications. And I'll literally organize them, and you know, that's a time that you can go through their thorough history and make sure that they're not having any drug-drug interactions. You can create a medication log. You can communicate that with their pharmacy. Kind of a set checkpoint, because prevention is one of the key things here. And we all say we all think we know what prevention is, but in order to be preventive, you actually have to take steps to do that. Taking steps. One of the things that is the biggest problem with geriatric patients is something called sarcopenia. That's sort of a wasting or an inability to build and retain muscle mass.
Okay.
You need that to be able to walk, to be mobile. There's a great study that was published in 2011 called the LIFE study, and it showed that they did a study on 1,700 people from the age of 70 to 89, and they all had impairments. And they found that after 2 years or so of moderate exercise daily, that they were able to reduce their risk for falls, fractures, hospitalizations, and comorbidities that come along with that. Again, all these things should be planned in advance with your doctor or your nurse or your dietitian, instead of ending up in Dr. Lepak's ER.
Sure. So be proactive.
Being proactive.
It's never easy once a diagnosis is made or when something goes wrong. And so I want to come back to you for a second, Dr. Hicks, and just talk about it, because you mentioned being that person for your father. I'm that person for my mother, although my brother, you know, she thinks he is. But it's hard. It's not easy.
No.
So you have programs at Parkland for the caregivers that can really help out, don't you?
Yes. So one of the main things we do is support our caregivers. We've actually, even though our clinic treats 65 and older, we've actually had to treat a caregiver who was in her 50s, but one of the nurses realized something wasn't right with the caregiver. So we do caregiver support classes. One of the main classes is dementia education that I just mentioned. We do information and referral when we find that caregivers are having a difficult time. We depend heavily on the community council that has a respite program, which is, you know, allows for a resource for individuals to have a break. Okay. And that's how we support our caregivers.
Very good. I know a lot of people are grateful for what you do to help them out, because it can be tough. Dr. Schmidt, I want to come back to you and talk about what older adults and their caregivers need to know about drug interactions, because that's very important as well.
Well, yeah, I mean, that's a big one. And again, that can for sure land them in the ER. Going back to what I touched on earlier, careful planning. I was talking to my wife, who's a nurse. We were talking about some of the common things that come up, and even little things like dietary changes that the patient may have. We all know about the grapefruits and the things like that can interact with drugs and change how the drug acts with the patient. But the little changes that a patient may make, those need to be recorded. Herbals, vitamins that they get over the counter. Just because something is over the counter doesn't mean it shouldn't be part of the record. And they can have significant interactions. And sometimes they can be subtle or take longer. I mean, if you have a patient on blood thinners and they start eating too many green leafy vegetables or having an extra glass of wine or whatever it is, I mean, these things can cause problems. In geriatric patients, their bodies deal with medications differently than they did when they were younger.
Interesting. And so, Dr. Lepak, what kind of injuries or illness usually bring an older person to the ER?
Well, all the medical illnesses that young people have, you can kind of double most of them for elderly. Maybe not appendicitis per se, or typical ailments of the middle age, or the younger people. But if there's a pneumonia or a flu or just a bad, nasty cold virus going on out there, or weather patterns that lead to slip and falls, or just whatever it is that would affect you, just triple it for the elderly person. And kind of getting back to what Dr. Hicks and Dr. Schmidt were talking about, when you present to that acute care setting, or just, you know, when you're getting ready for your regular medical updates, having that medicine list, it sounds banal, like, you know, of course I would have a medicine list, but it just amazes me in my own family or in the general public how many people don't have a list of the person they're responsible for's medicines or allergies. And there's really no excuse with the cell phone technology. You can take a picture of their medicines. You can certainly take the 5 minutes to write them down or type them up, might be even better. You can carry it around in their wallet, you know, as a little fold out this big, or have a picture on the cell phone, or some people will even be more proactive and have their list kind of shrunken down to where it's legible, and then it's easily presentable to the, because in an acute care setting, we really need to know.
As young people would say, I'm sure there's an app for that.
You know what? I'm sure there are
if
a
there's
few.
not, y'all need to invent it right away. It'll make you rich, yes.
Sure there's a few.
And so, Dr. Hicks, I want to ask you really quickly, which Parkland facilities in Dallas County actually offer geriatric services?
So we have 5. There's one, Daharo, which is off 30 and Westmoreland.
Okay.
We have Hatcher. Blewett Flowers, Southeast, and Garland. And at our main location, Amelia Court, is where I'm located. And so at the Amelia Court location, not only do we offer the clinical services, but we also teach at that particular location. We teach the resident the internal and family medicine and also psychiatric care, and we teach fellows geriatric and psychiatric care. But one thing is kind of on me when you started with the medical medicines and talking about writing those things down. One of the things that we found, because we deal with so many individuals at Parkland, cultural. We have to think about some of the things that people do as far as home remedies. So not only do we have to ask about those vitamins, but we found that some individuals, they file dimes because they think that's gonna, it's a cultural thing.
File dimes?
They'll file a dime.
Okay.
And take it thinking that they're going to, but it's a culture thing. So you have to ask about these home remedies also. And we're really heavy on medical adherence. So we give little bags. They're lunch bags for us. They're insulated, but we ask all of our patients to, take the bag and put all their medications in, and also write down some of the other home remedies that they might take to, that they grew up with traditionally to cure certain things that may counteract the medicine and the care plans that we have. This is what we found is people put, their medicines in plastic Walmart bags or other plastic bags, and those bags have holes in them, and then they lose their medicines. So we give them these lunch bags, so to speak, to keep their medications in.
And that's really critical. I'd add to that. That sounds like a great idea. I mean, sometimes patients will go to different care providers too throughout the year. They may be in a different state and have to go to an urgent care. Well, they may not have access to their medical records, and a patient, especially an elderly patient or a geriatric patient, may get a duplicate of a certain medication, bring that home and continue taking it, like 2 blood pressure medications. Well, what does that do? Creates a risk for fall because they're dizzy and they have low blood pressure. So any process that you can stick to and be consistent with, that makes a huge difference.
You can never have too much information to share with you.
You're right.
Hey, I want to go back just for a second and Dr. Hicks, ask you about Parkland's services at Irving's Health Center. Do they offer geriatric care there?
So we don't have a geriatric specialty unit there, but they do treat individuals 65 and older. And if there's additional services that are needed regarding the older adult, then the main hospital, the main location, Amelia Court, supports. So just say hypothetically someone that's caring for someone with dementia, then we would offer the dementia caregiver class for that individual for Irving. Okay. So we support them beyond just the clinicianal care.
Wonderful. Dr. Schmidt, I want to come back to you and talk about prevention again. I know the American Heart Association just put out new guidelines for older people, and I want to talk about how important exercise is.
Well, from toddler to geriatric, it's important, right? I mean, there are, obviously there are plenty of people who are younger or middle-aged that should take the advice here, but regarding the geriatric population, it's paramount. Now, I would give the disclaimer that if anybody is listening and thinking about just going out and putting on their Nikes, and you definitely want to first create a safe plan and make sure you're cleared to do this type of thing with your doctor or healthcare provider, nurse practitioner, PA, whatever it is. But it's critical. I mean, life in biology is about movement, and if you can get your body moving and be consistent with it, and we're not talking about running the New York Marathon, we're talking about might just be walking a few laps around the house. And then one of the things I always tell patients of any age, particularly geriatric patients, is if you are in a plan or going to exercise, and some people want to be independent and go out for a walk, little things. Take your cell phone. Let people know where you're going to be.
Smart.
Have a dedicated plan and a route. Write it down like you have a fire plan in your house. Let people know where you're going to be, because if you have a patient who suddenly becomes delirious or may have dementia, they like to walk off anyway, and people need to know where they could be. So that doesn't turn into anything worse.
Sure, thank you for that. And what about outreach services? What kind of programs does Parkland offer for that?
You'd have to defer back to the expert on that.
She's got that one.
So we offer the SOS program, which is the Senior Outreach Services. Through that program, we have case management, and also they do screenings. So if we're at a health fair, through that program, we can do blood pressure screening, sometimes a small prick for the diabetes screening. And we also do the education part. So that's one of our main parts as far as doing the outreach. We do the, when we attend the health fairs, we provide information on age-related issues and yeah, just lost my train of thought. But
That's okay.
we offer the health information on age-related issues, and then the other support is through the dementia education class. I cannot stress that enough. And the advanced care directives, and we have other initiatives. And I just want to kind of mention about, you mentioned about exercise. So we're looking into adding the aging mastery program, which is through the NCOA, and it's a 10-course program that really promotes aging well. And so we look forward to promoting that as far as one of our outreaches too.
I think my wife is signing me up for that already.
Oh, she's already got you on there, huh? Dr. Lepak, what kind of advice can you offer to people to stay out of the ER, especially when it comes to geriatric patients?
Well, it just kind of adding on to what has already been said, and particularly this time of year where it's kind of gloomy, and people think, oh, I'm just depressed or whatever. No, you can really be dysthymic from the weather patterns. You go to work when it's dark, you come back home when it's dark, the days are short, but a lot of studies have shown that energy levels, kind of an anti-depression formula really is lean proteins, daily exercise, some outside exposure, some sun exposure. Of course, if you can go to Mexico, that's great, but just some sun exposure and making sure you take the right kind of multivitamin, maybe some vitamin D supplementation too, as kind of an anti-depression formula this time of year. I think those 4 basic things, kind of mom's old advice, get outside the house and eat your vegetables, really is essential, and we really kind of overlook it. We get busy, it's not nice outside. We do skip on the exercise this time of year, and it's hard to eat lean, the holidays and so forth, but lean protein, exercise, vitamin D, and some outside exposure, some sun exposure for everybody. My dermatology friends, I don't want to say go lay out and suntan, but some sun exposure, some outside exposure, some sunlight exposure for your pineal gland particularly is what I'm talking about. More of a retinal thing than perhaps a skin thing.
You look like you want to add to that, Dr. Schmidt.
No, seasonal affective disorder. I mean, the acronym is SAD. I mean, it happens. You don't have to live in Fargo or, Anchorage to have to deal with these things. But I mean, they happen here. And so, yeah, I would concur and add to that. I mean, absolutely. Multivitamin, again, making sure that that's on your list. Just because you can grab it at, your local supermarket or pharmacy, it's important to know for your doctor or provider. Hydration, water is a huge thing. And culturally, there are a lot of adults that, well, they'll say, Dr. Schmidt, I drink a lot of stuff every day. Do my 8 iced teas count? Well, no, actually, that does the opposite. Things
Right.
that have caffeines move your fluid out of your body, so things need to be replaced. And that should be an important part of the overall health and wellness plan. Those tiny little things add up and make a big difference. Yeah.
Having a plan, having it in place, and you're helping them do that with Parkland. Dr. Hicks, one more time, give us the website and also the email and how people can get information about these great programs you offer.
So the website is parklandhospital.com/geriatrics, or our main location phone number is 214-590-8369.
Now, are the programs offered annually, all year round? You have different things going on?
We do have different initiatives. I just mentioned the one. We have the medication adherence, the initiative for the advanced directives. We're really excited about aging mastery. We do aging sensitivity. Well, I do aging sensitivity to make sure that we keep older adults at the forefront. And if you visit our website, we always post those exciting things that are happening at Parkland.
Wonderful. Thank you all so much for being here.
Thank you, Starlene.
You're welcome. And thank you for watching this edition of Open Line. I'm Starlene Stringer. Please be sure to join us on Thursday, February 7th at 1:30 p.m. when our guest will get you ready for the North Texas Teen Book Festival 2019. We'll see you then.